Lil. Hey, Miss Lil. Are you ready? Look at her. Okay. Happy Friday, Baylor College of Medicine and friends of Baylor. What a week. What a week. So many questions, so much confusion. It's probably worse than it's been in terms of people understanding what's going on since I started all this. I've gotten so many questions. How safe are the vaccines? How effective are they? Do I need a booster? Should I wear a mask? Can I go out? Can I travel? Is Delta Airlines going to change their name to Vaccine Airlines? Who knows? They need to do something. They don't want to be named after the Delta virus. But my sister's been all over me all week, so I'll try to deal with some of the big issues. The world numbers continue to go up, you know, and even in highly vaccinated countries, Western Europe, the United States, all being driven by the Delta variant. And finally, new cases are beginning to fall in South America and India just because they've peaked. In Indonesia, it's still a mess, lots of infection and higher mortality in children, and we really actually do not know why. I talked about that last week. And less developed countries are clearly falling behind in inoculations. And, you know, think about, you know, long term, this is going to really impair their ability to, sustain an economic recovery. So it continues to have a huge impact on the world and the world's economy. And we've given almost 4 billion vaccines, at least one dose of vaccines worldwide. But there are countries that have had less than 1% of their population vaccinated. So the disparity between those who have the money to get the vaccines for their people and those who can't is really widening. And that is driving worldwide infections and also driving the development of variants. If you look at, we're clearly in a pretty steep phase of the fourth phase of the worldwide pandemic. And the hot spots are really changing. I mentioned Namibia last week, Libya, and Indonesia and Malaysia are really turning into hot spots, as well as Kazakhstan and Mongolia. I always like to look at Israel because they're the farthest one ahead in terms of total vaccinations. They have almost 60% of the population totally vaccinated. And it's to their benefit, but you can see there's beginning to be a small increase in case numbers. Their mortality rate remains very, very low. And the case rates that they're getting are predominantly in unvaccinated and children, but they're getting a fair number of breakthrough infections, as you would anticipate. I think we're all getting surprised. You know, when something's 85, 90% effective, that means 10% of the people will get infected. And as you get more and more exposure to a highly contagious and infectious virus, we're going to start seeing those breakthroughs. So what about in the United States? Well, we've seen a fourfold increase. Lily, what are you doing? She's distracted. Fourfold increase in new cases day over day for the last month. The good news is that the 3 approved vaccines remain and continue to be effective. Every state is reporting slight increases, some more than others. But if you look at it, 97% of hospitalizations related to coronavirus are in unvaccinated people. So the vaccines are working. The same states continue to be problematic, the ones with the lowest vaccination rates: Missouri, Arkansas, Louisiana, Florida, and some parts of Texas. You know, it's a real problem. The Biden administration announced that we'd hit their target of 70% vaccinated. Well, not really. That's only for those over the age of 18. If you include 12 years and older, which is now approved, that's only 57% of the total population. So it's not exactly 70%. But, you know, we got to applaud the benchmarks that we reach. The real sad part is there, you know, you got states like Vermont that 2/3 of the population are vaccinated, and you got states like Alabama and Mississippi where 1/3 is vaccinated. And that's a real problem because the ones that have the lowest vaccination rates are the states that are having the highest case rate and highest mortality. The USA is firmly in its fourth peak. You can really see how dramatic that is. And if you look at it, the fully vaccinated population now in the United States is really only 49%. So in other words, 2 doses of Moderna and Pfizer, 1 dose of J&J, and 2 weeks out. If you look at least 1 dose, that was the 57% if you include all eligible people, or 70% if you include everybody over the age of 18. So, you know, my sister's always, what's going to happen? But she's so sick of staying at home. What is going to happen? So let's turn to our friends in University of Washington, in the Institute of Health Metrics and Evaluation. And they've mapped it out, and they've been right all along. It sort of looks like we're going to peak around September 16th, and our death rate will peak around October 10th. So we got another month and a half of dealing with this, unless we can improve our vaccination rate. And the main reason is the Delta variant. The Delta variant last week was 83% of the viruses. This week it's about 88% of the viruses. You can see it just totally dominating in terms of viral infections. And the hot spots get hotter every week. Florida is even hotter than last week. So Missouri, Arkansas, Louisiana, and you can see parts of Texas too. We're not doing so great in some of the mountain states. And if you overlay that map with the vaccination rate map, it's identical. It's the lowest places, 37% in Arkansas, 34% in Louisiana, 32% in Mississippi. It's just, I don't know how many different ways to say it. Go get vaccinated. People, just get vaccinated. And look at, if you want to look at a fourth wave, I'm not sure what you call that. I call that a tsunami in Louisiana. That is crazy peaking. Now, Texas is not great either. We're going up now. We're in our fourth phase. And again, it's largely being driven by the unvaccinated. And guess what counties? I'm so sorry, because I know we have viewers out there in Dimmitt County. You guys are doing the best you can, but oh my Lord, every week, high vaccination rates. I'm not exactly sure why. Again, I think it's related to that facility you all have, but what are you going to do, Dimmitt County? At least you got javelinas running around, so that's a good thing. So here in the Texas Medical Center, we're reflecting like everybody else. Our numbers up. It's over 1.4, 1.5. You know what? When people said, when do you feel comfortable? And I said, about 40 cases a day. We're at 2,000 cases per day in our catchment area. Our positivity rate, which just 2 months ago was around 3.5%, 3%, is now 12% for positive tests. And you can see the number of cases is just, really skyrocketing. And like, many of our viewers have said, well, what really counts is the hospitalizations. Okay, well, here's the hospitalization rate. We're averaging over 250 new admissions per day in hospitals, in our hospital system. So, there's all kinds of rumors going on. One thing that was published in the media was like somebody was saying that if the mortality rate and the case rate is worse in the vaccinated than the unvaccinated. I don't know how this stuff gets on social media, but I thought this would be very revealing. These are the actual case rates in vaccinated versus unvaccinated. These are the fully vaccinated people, almost nobody, and these are the unvaccinated. Those are chart diagrams. And then these are the mortality rates. Fully vaccinated in green versus unvaccinated. That's real data. So I don't know what people are talking about when they say that. In fact, those places that are unvaccinated, well, I think people are beginning to get the idea they better get vaccinated, because for the first time our vaccination rate is actually going up. And if you look at where is it going up the most, it's in Arkansas, Louisiana, Missouri, and Florida. They're going up 2 to 4-fold. I think you see, if you're living in those states and you look around and you see how many people are getting sick, finally people are beginning to realize that there's no hiding from the Delta virus. It's going to find you. So anyway, big news this week was this outbreak in Massachusetts. And I want to talk a little bit about it because it seems to have scared a lot of people. But let's think about breakthrough infections overall. The CDC, as you know, reports breakthrough infections. And we've always said the mRNA vaccines are about 95% effective in preventing symptoms and close to 100% in preventing serious illness and death. But that was in studies that were, 40,000 people. We've now given 163 million people vaccines. So, there's a signal you sometimes can detect in 40,000. There's a signal you detect in 100 million people. So if 163 million people were vaccinated as of July 26th, my birthday, by the way, and only 6,587 documented vaccine breakthroughs. 75% of those were older than the age of 65, and 1,200 deaths. 163 million vaccinated, 1,200 deaths in vaccinated people. I mean, unbelievable. But there was this recent report from Provincetown, and I want to talk about that because this got a lot of press in Barnstable County, Massachusetts. So there's a festival there from July 3rd through the 17th. It's 2 weeks. And it attracts thousands of people from all over the country. And it is described by the people in Provincetown as an event where there is, quotes, densely packed indoor and outdoor venues, bars, restaurants, guest houses, and rentals. Now, Provincetown has a population of about 215,000, and they had 750,000 visitors. So it's about 1 million people show up, densely packed in a small town. And before this event took place, this 2-week event, Massachusetts in general had about 69% of the population vaccinated, and they had 0 cases of COVID. Well, over the next 2 to 4 weeks, that's what happened. Big rise in number of cases. And so that got a lot of press, and that was reviewed by the CDC because the Massachusetts has a very good state Center for Disease Control, very good at tracking down and case evaluation of positive cases. So this came out of the Massachusetts Center for Disease Control. So they identified 469. Remember, there were 1 million people there. 469 cases in Massachusetts residents. 74% of those were in fully vaccinated people. That's what got the news. Oh my God, 340 people who were vaccinated got infected. The problem is what was the denominator of how many people? And 90% of those were from the Delta variant. Of all those patients, 5 were hospitalized. 4 of the ones that were hospitalized were vaccinated. 1 was unvaccinated, and no deaths were reported. One of the things that got people a little bit nervous was the fact that the viral burden was high in those. I want to spend a little time talking about that in a second. But the thing is that if the vaccine is 95% effective, it's one thing if you have 469 people infected out of 1,000. It's another thing if it's 469 out of 100,000. That's 5%. If it's 469 out of 1 million, it's 0.4%. So it just depends on what the denominator is. We really don't know. And when we talk about crowds, what do you mean by crowds and densely packed? Well, that's more than a crowd and more than densely packed. I would say a crowd to me is like I went to a crowded grocery store. There are people walking around. Or you could I went to a baseball game with 50,000 people indoors. Or you could say I was in a mosh pit, banging around with 1,000 people. Or you could say I went to Provincetown, which is like twice as bad as a mosh pit. So I think that a little bit overblown as to what it really was. And remember Sturgis. Let's compare it to a similar outbreak. Sturgis last summer. Remember that 500,000 people went to Sturgis, South Dakota. There are 7,000 people in Sturgis for a 10-day motorcycle rally. Comparable. No social distancing, no masks, and this was pre-vaccination. From that alone, just in that town, 649 cases, 1 death, and 17 hospitalizations. But when they looked at what was the impact, how many people were infected, the Center for Health Economics and Policy at San Diego State University tried to actually figure it out, taking people who went to the Sturgis rally and then following the number of increased infections in that county versus counties that didn't have folks that were in Sturgis. They estimated that the number of infections was 266,000 from that event at Sturgis. So comparable size, pre-vaccination, 266,000, post-vaccination, 469. So, you got to put it in perspective. It was people that were vaccinated got infected, but, not compared to what it would be like if they were unvaccinated. So that's really the thing that really scared people, though, or the real interesting discussion has been, we measure viral burden in people by looking at the PCR test and the number of cycles it takes to amplify something you can detect. It reflects how much virus there is, and if it's very easy to amplify very early on, Very detection means you have a lot of virus. If it takes a lot of cycles of amplification, it means you have very low viruses. And in this particular case, the viral load was in the vaccinated people was as high as unvaccinated. Now, that's different from other reported data. There have been plenty of examples where the difference between vaccinated and unvaccinated is somewhere around tenfold differences in the viral load. But in this one outbreak in Provincetown, it was about the same. So why is that, and how can we explain it? We don't know. I mean, I'll just be honest, we don't know. But I think that you have to think about immunity in general. You know, when you get infected, it ends up starting off in your upper airway. And in your upper airway, there's not just immunoglobulin G, but IgA, which is a very important immunoglobulin for mucosal immunity. And when you first get infected, the first thing that happens, this is a good diagram, you get the virus, and the first immunoglobulin stimulated is IgM, and then IgG and IgA are stimulated. And IgM goes away pretty fast, and IgG and IgA are sustained. And there's a lot of data. There was a great study in Science Translational Medicine from Sterling et al. That showed that IgA dominates when you get infected in your upper airway. This secretory immunoglobulin, it's very important for preventing the virus from entering, is very high and dominates in the upper airway and nasal secretions and even in the lung. So why is that important? A recent study in PLOS One just this last month looked at 4 people who were vaccinated with Moderna and Pfizer and looked at their ability to generate immunoglobulin G, which is the one we usually think about when you get an IM injection, and immunoglobulin A, which is the one that's in your nasal passages. So what you can see is IgG response went up in these 4 people, and they followed it. Wanes over time, but not that fast. But IgA drops pretty fast. And this is a good example of these 4. The IgA drops pretty fast with vaccination. And so it's possible that because your IgA wanes, that when you're infected, it's able to replicate in your nose and your upper airways at a pretty brisk rate after a while. And if you do a PCR analysis, you might get higher numbers than you would think if you measured it in the blood, for example. So, you know, that's the whole thing, is you might get exposed and have virus replication in your upper airway, but it's not causing severe disease because you have all this immunoglobulin in your blood ready to attack them. Now, there's one very interesting study that also came out in Nature this past month that looked at how long does immunoglobulins stick around. And this was from Wuhan and people who were actually infected, so convalescent titers. And it's sustained for a very long time. But we recently looked at data from Pfizer, and this was from Bill Gruber, actually. He presented grand rounds at Texas Children's. He's a Baylor grad. We're very proud of him. He's his group was responsible for developing the Pfizer vaccine. And they showed that if you look at vaccine responses for immunoglobulin G, it begins to wane over time. And you can see that, you know, it's dropping. And then they're very big on, of course they are, on a third dose, a booster dose. And he showed that if you get a booster, you can very quickly increase that IgG. The one thing, if you recall from last week, we talked about is we don't know that that's that important in protecting you. It looks like it really is, that neutralizing antibodies are the most important thing. But over time, we showed this little diagram where you begin to, your immunoglobulin levels wane, but we don't know that the memory T and B cells aren't sufficient to turn it back on. And so this is the big discussion going on with booster shots. And you know, it's a little bit of a hard analogy to this from my sister. You know, if it's raining outside, it is pretty clear if you walk out and you have a big umbrella, you're going to be less wet than people who have little umbrellas. So that's kind of where we are with neutralizing antibody. We know in the beginning, if you walk out of your apartment, you're going to walk down a block. The people who have a lot of protection are going to be less wet than the people with a little protection. The thing that's different, the magical thing is, imagine as you're walking down the street, your umbrella gets smaller and smaller. You know, now it's a race to get to the end of the block before you get wet. The other added nuance of this is there's umbrella stores all along the way. So you can always, if your umbrella gets too small, you can get a new umbrella. That's kind of what memory B and T cells do. So we don't know yet. We know that as you walk out of your building, having protection is really important. We don't know that over time it's critical. And maybe having an umbrella store down the road is more important than having an umbrella to begin with. So that's kind of where the science is. We just do not know yet. And we won't know until we see the number of people who are getting infections. But All the talk now is booster shots. Should we be getting them because our immunoglobulins are waning? Germany is following Israel's example in offering booster shots to high-risk citizens. France, Russia, and Hungary are doing the same. The WHO has come out against booster shots because half of the world is not vaccinated. So, that's a parity issue, a fairness issue. But U.S. policy right now from the CDC is there's no need to get a booster shot because we're not seeing a lot of breakthroughs. But there's a lot of talk that that immunocompromised individuals and those over 65 may well be getting booster shots or being recommended in the near future. So we just have to wait and see. So I just want to remind everybody, the most important thing, vaccines are safe and effective. Breakthrough infections were always expected, and we're seeing them at about the rate we would expect. We know that the immunoglobulins wane over time, but we don't know yet how important that is. And I've said this a bunch of times, booster shots are probably in our future, but not necessarily now. And anyone who's unvaccinated or around crowds right now should wear a mask. I have said from the day one, I don't feel comfortable when there's a lot of virus in the community walking around, walking into crowds, even though I'm vaccinated. And I think that's the way we should think about it. If there are crowds and you don't know vaccination status, you should wear a mask. If you're with friends and you're all vaccinated, the chances of transmitting anything between you all is very low. And the real concern is kids under 12. You still have to protect them because they're not unvaccinated. So now's our time for the Olympic update. My favorite thing, Japan just reported 12,000 new coronaviruses on Tuesday, their second highest ever reported. I'm sure they're all begging for the Olympics to end. They can't wait till that light goes out and Lily goes home. And 18 more people who are athletes and associated with the Olympics are now infected. So, world record still holding. Japan is leading the way. And I want to end today with shout-outs. First to Bill Gruber, he's the Senior Vice President of Pfizer Vaccine Clinical Research and Development, and was responsible really for the global development of the Pfizer vaccine. So he's a graduate of Baylor College of Medicine. He trained in pediatrics here. He was on the faculty, and we're very proud of him. And he gave a great grand rounds, which I listened to. And I also want to congratulate Norbert Bischofberger, who was just recognized as one of the 100 most inspiring people in the field of pharmaceuticals. And he's certainly inspiring to all of us, and honorary degree holder from Baylor College of Medicine. We're very proud of him too. So have a great weekend, and I will see you next week.
Come on, Sweetie, come on.